Hello, everyone. My name is Olga Esparza, and I am a health equity specialist with Iowa Total Care, along with my colleague, Kate Tanat. And today we wanted to talk to you about language services and their connection to health equity and why those are important. So I will begin sharing my screen here. All right. So at Iowa Total Care, we strive to understand, appreciate, and interact with people from different cultures or belief systems different from our own. So we are committed to providing our members with culturally and linguistically competent care and providing limited English proficient persons access to qualified interpretation services can help improve health outcomes and quality of care, as well as help eliminate racial and ethnic health disparities. Language barriers, cultural misunderstandings, and low English levels are some of the factors that can contribute to poorer health outcomes for many populations of color. So currently in Iowa, the diversity of our population includes over 140 spoken languages and cultures, and over 8% of our population has identified as speaking a language other than English. So to address this diversity in the state of Iowa, we have developed tools like our language identification poster, which basically is a poster that has a phrase on there that a member can point to in their language if they need an interpreter. And this can be used with limited English proficient persons when their language is unknown. So another tool that we've developed for our community partners is our quick reference guide for language services. This quick reference guide provides an overview of the various ways we provide interpretation services to our members. It also includes some additional education, such as best practices to working with interpreters, communication tips when working with limited English proficient persons, and our notice to please avoid using minors, family members, or friends as interpreters. Now, there are several federal laws that protect patients from being discriminated in healthcare settings. To name a few, we have Title VI of the Civil Rights Act of 1964 that stipulates that no citizen may be denied the benefits or services of any program, healthcare or otherwise, that receives federal funding because of discrimination based on color, race, or national origin. Programs that are in any way funded by the Department of Health and Human Services, or HHS, must also provide interpreters for patients who do not speak or understand English. Section 1557 of the Affordable Care Act also enforces Section 1557, which prohibits discrimination on the basis of race, color, national origin, age, disability, or sex, including pregnancy, sexual orientation, gender identity, and sex characteristics in covered health programs or activities. Now, there are other laws such as Title II of the American with Disabilities Act and Title IX of the Education Amendment and the Age Discrimination Act that also protect patients. Additionally, these laws protect patients from being denied services, substitution of services, or segregation. These standards, again, all provide that an individual cannot be denied access to healthcare or health coverage or otherwise be subject to discrimination because of race, color, national origin, sex, age, or disability. Federal law also prohibits providers and staff from recommending or requiring the use of family or friends to interpret or requesting patients to provide their own interpreter. Having programs like our language services and addressing known disparities within our women's health, behavioral health, and infrastructure work groups, we are providing our members with more equitable health care, resulting in equal access for all. In addition to language barriers, there are other social factors that influence a patient's health. These are referred to as social determinants of health. These are the underlying socioeconomic factors that contribute to health inequalities between different groups or sections of the population. Now at Iowa Total Care, we take addressing these needs to the next level by connecting members with resources through our housing or resource specialists. Now, our housing and resource specialists are able to help connect members to address those food insecurities by connecting them to pantries and providing them with resources within their communities for utility assistance, assistance with diapers and formula, clothing. In other words, all of the social determinants of health. Now, for additional resources, you can always visit our website at www.iowatotalcare.com. Or if you have additional questions regarding our resources, please feel free to reach out via email, and I have those listed here for a quick reference. So I hope all this information has been helpful, and I want to thank you all for having me here today and just listening a little bit more about what we do here at Iowa Total Care. Thank you.